Thanks for everyone who's joined us so far. We're going to start the program in about 2 minutes once everyone's let in from the waiting room. Thank you. Okay, we can get started, and people might be joining us, but we can get the program started. Hello, everybody. I am Babette Henderson. I am the Senior Director of Alumni Engagement at the Feinberg School of Medicine, and I'd like to welcome you to our virtual ISGM engagement event. On the screen, we've got a list of a few things that we're going to cover, housekeeping issues. The first is if you'd like to ask a question of us or the presenters after the presentation, please utilize the chat feature below on your screen. Please use that instead of the raised hand, as our moderator will be posing the questions to the panelists. We also encourage you to use the speaker view versus your gallery view to view the meeting. And all attendees are going to be muted throughout the meeting. So again, the best way to communicate is via the chat feature. And if you have an unstable internet connection, you can increase your speed and connectability by turning off any of your applications or internet connections on any of your other devices. I would like to now introduce our moderator for the event, Larry Kuhn, who is our Associate Dean of Development and Alumni Relations at the Feinberg School of Medicine. Larry will introduce our panelists and moderate our question and answer session after the presentation. Larry?
We also welcome you again to our virtual Pride Edition event here, featuring the Institute for Sexual and Gender Minority Health and Wellbeing, known as ISGM, the largest institute in the U.S. to focus on sexual and gender minority health research and the next wave of LGBTQ rights, which you will hear more about in the next hour. ISGM was founded in 2015 during a critical period in LGBTQ history. That same year, the Supreme Court struck down bans on same-sex marriage. Commenting on the history of the case, former Supreme Court Justice Anthony Kennedy shared that it was born out of the LGBTQ movement's pursuit for equal dignity in the eyes of the law. We also celebrate the recent Supreme Court victory affirming employment protections for all LGBTQ workers, and it's given us reason to celebrate and will have a considerable impact on the lives and livelihoods of our communities across the country. Now let me introduce our speakers. Brian Mustansky, PhD, he, him, is a tenured professor of medical social sciences at Northwestern University, founding director of the Institute, and a proud Northwestern alumnus. His research focuses on the health and development of LGBTQ youth and HIV prevention. He has been a principal investigator for over $60 million in federal and foundation grants and has published over 265 journal articles. He's a frequent advisor to federal agencies and other organizations on LGBTQ health and HIV prevention, including serving as an appointed member of the National Advisory Council on Minority Health and Health Disparities. In 2017, Brian was selected from 1,600 nominees as one of 30 change makers and innovators making a positive difference in the community. Francesca Gaiba, PhD, she, her, or they, them, is a research associate professor and the associate director for ISGM. Dr. Gaiba earned her BA from the University of Bologna in Italy and her PhD in cultural anthropology from Syracuse University. She brings a commitment to racial and LGBTQ justice and their intersections to her scholarship and academic work. Thank you both for being our featured speakers today. Francesca?
Thank you, Larry. I'm going to start sharing my screen, but I would like the director of our institute, Brian, to give just a brief welcome.
Yeah, thanks, thanks Francesca, and thanks Larry for that introduction. I just want to say welcome to everyone, and that we really appreciate the turnout today, and want to welcome all the Northwestern alumni, friends, parents, allies, and donors and supporters of the work that we're doing for joining the call today, and say to you all, Happy Pride Month. We look forward to telling you more about the work that we're doing to advance LGBTQ health here at Northwestern, and really have some good time to answer any questions that you have. And so look forward to sharing with you, and just say, as a Northwestern alumni myself, I'm really excited to get this time with you and look forward to sharing.
Thank you, Brian. I also want to wish everybody happy Pride and welcome to this presentation. It is my pleasure to tell you a little bit more about the work of our institute. We will go over who we are at the institute and introduce you to some of the work that we do. Our mission is a three-part mission of research, training, and education and dissemination. Our institute is called Sexual and Gender Minority Health and Wellbeing, and you may wonder why we use the word sexual and gender minorities instead of the more standard acronym LGBTQ, which stands for lesbian, gay, bisexual, transgender, and queer. We decided to use the umbrella term sexual and gender minorities because sexual orientation and gender identity are changing all the time. And 5 years ago, when we founded the institute, we realized that we could be outdated in 2 or 3 years if we only listed a specific number of identities. In addition, the federal government also uses sexual and gender minorities as a term. So it's good to get on board with the federal language, especially when you're requesting funding. We were founded in 2015. We are the largest institute in the world of its kind, focusing specifically on LGBTQ health. We've grown tremendously since the inception, from 30 to 97 employees, including 13 faculties and 6 postdoctoral fellows. As I mentioned, we are funded by federal funding, and we have really beautiful facilities on Michigan Avenue in Chicago in the Magnificent Mile. And we invite you all to join us for a tour post-COVID-19, when we can open our doors to show you our beautiful facilities. These include a multi-stall, all-gender bathroom, which is we are the only unit on campus to have such a bathroom. Our work also features a lot of partnerships with community organizations, and we are proud to be hosted by Northwestern. Northwestern is our home and is such a prestigious university, top 10 in the country. So it's a wonderful university to be working with. And I'd like Brian to tell us a little bit more specifically about, how our research has put us on the map in SGM Research.
Yeah, thanks, Francesca. So as you'll see in the bubble map on the screen, which is created by the National Institutes of Health, or the NIH, which is the largest funder of biomedical research in the world, in 2017, Northwestern was the 3rd largest university in terms of sexual and gender minority research grants from the NIH. That's continued to grow and expand at Northwestern. We look forward to seeing the next map when it comes out. I think there's a chance we may have overtaken the #1 slot. And that really reflects the breadth of sexual and gender minority research taking place at Northwestern across many of the schools and many of the Feinberg departments, from folks who are doing more psychological research, people who are doing infectious disease, cardiovascular disease, cancer, dermatology, looking at skin cancer screenings, etc. The breadth of sexual and gender minority research at Northwestern is quite impressive. And I think that is part of what's really positioned us to be a national leader, and really now the largest institute in the world focused on conducting research that advances understanding of sexual and gender minority health. I serve on the Council of Councils advisory group on sexual and gender minority health for the National Institutes of Health, where we look at this portfolio analysis every year. And actually the funding for sexual and gender minority research at the NIH has gone up year by year. It's around $200 million, which is still, you know, a significant increase, but really a drop in the bucket when you think about the amount of research that the NIH funds every year. And so we really do believe that it's important to continue to expand that work. And the majority of that work currently focuses on HIV, and we know that there are a number of other health disparities experienced by our population besides HIV. You know, in our role as as the largest LGBT-focused research institute in the country, we've really helped been a catalyzer of creating bridges and linkages between our federal partners, between researchers, between community organizations, and healthcare providers. And I think you'll hear a little bit more about that as we go through the presentation.
Thank you, Brian. So now onto what we do. As I mentioned, the most important part of our mission is conducting research. You have heard Brian use the word health disparities. And in a moment, I'll ask him to tell us more about that. But I just wanted to preface, many of you know this, and I know I'm preaching to the choir, but it's important to remember that when we talk about LGBTQ health, that there is nothing inherently pathological about any gender identity or any sexual orientation. It's often the discrimination and the oppression that LGBTQ people face that results in adverse health outcomes for us in this population. And this is the case also for other minority populations that experience oppression and discrimination. So Brian, can you tell us a little bit what health disparities mean, and especially in the context of LGBTQ people?
Sure. So when we talk about health disparities, we mean that there are certain populations in the United States that really don't have equal opportunity to achieve their optimal health relative to other populations. And when we think about sexual and gender minority people, we think about issues like LGBTQ youth being more likely to make a suicide attempt or die by suicide, LGBTQ youth still being more likely to be homeless, lesbians being less likely to get preventive services for cancer. We know that gay and bisexual men continue to be disproportionately impacted by the HIV epidemic, and so on and so on. We know transgender individuals have a higher prevalence of victimization, less likely to have access to health insurance. And so these are really important considerations. If we really want equality, it also needs to be reflected in our health. And that advancement of our equality and our health equality needs to come from a place of understanding that LGBT health has to begin by understanding the history of oppression and discrimination that these communities faced, and that these health disparities are largely driven by these social determinants that stem from this history and current experiences of oppression and discrimination. Just keeping in mind, very recently, the Supreme Court creating equality in terms of the right to work, despite a person's sexual orientation. That's a decision that just came down this week, and last week. And at the same time, the movement to remove access to healthcare equality for transgender Americans through the current administration's policies. So, we really are in this environment where we're seeing sometimes 2 steps forward and 1 step back. And that's really important in our understanding of the drivers of these disparities over time.
Thank you. One of the hallmark of our institute is that the research that we do has direct impact on the lives and health of the entire population, not just LGBTQ people. For example, one of our very popular op-eds that our faculty prepared talked about heterosexual parents who have a gay or lesbian or transgender teenager, and how do you as a person who has not experienced coming out or has not experienced that sexual orientation or gender identity, how do you help your teen begin dating, creating healthy relationships, etc.? And so this is an example of how our research can directly help people across the United States. This slide shows you the areas of strength of our research. These are areas that we publish continuously. And one thing that I like to highlight is that a lot of people think that minority health is often about mental health because of the experience of oppression, as I mentioned earlier. But there are real physical consequences to these experiences of marginalization. In fact, some of our research addresses cardiovascular health and inflammation, and I'd like Brian to tell us a little more about that, and also about racial and ethnic differences in these health outcomes.
Yeah, I think that that's a really great point, Francesca, that when we think about how people experience stigma and discrimination, we often think about the psychological impacts, but there are also really toxic physiological impacts of those experiences. And one of the really provocative studies that our institute published last year was focused on inflammation in young gay and bisexual men in Chicago. And one of the things that we did, collaborating with a group of virologists and infectious disease doctors and human biologists, is we began looking at the question of what levels of inflammation are we seeing in this group of young men? And our question was really started by the observation that people who are living with HIV, even when it's well controlled through treatment, often see excess levels of inflammation. And that is one of the things that we think may produce later chronic disease development, including disproportionate risk for cancer amongst people living with HIV. And our question was, are we seeing that in the young people in our cohort that we lead here in Chicago called RADAR? And so that was really our question. Are we seeing high HIV-related inflammation in the young men? And we compared them to young men who were not living with HIV. And what we found was very high levels of inflammation across the board in the group of young men. In fact, about half of them had a CRP value over 3, which the American Heart Association considers a value that puts you at higher risk for cardiovascular disease. You usually see those values in older adults. It would be very unusual to see those in such a young group that we study of adolescents and young adults. And we really think that that's driven by experiences of discrimination, stress, but those are things that we need to investigate fully to understand both what are the mechanisms and processes that lead to the development of this excess inflammation, how is this inflammation related to later health outcomes, and then how can we begin to create interventions that might ameliorate that inflammation. Similarly, I would say a big signature focus of the Institute since its founding has been this question of the intersection of race and ethnic minority groups with sexual and gender minority groups. We've really led much of the work to understand this profound disparity in HIV amongst gay and bisexual men. The CDC estimates that about 1 in 2 Black gay and bisexual men will become infected with HIV at some point in their life, whereas that number in white men who have sex with men or gay and bisexual men is much lower, although still quite alarmingly high. And what drives that? I think traditionally people look at these questions and assume that they're driven by differences in risk-taking behavior. But in fact, our research shows that young Black gay and bisexual men actually engage in less risk-taking behavior than their white peers. And instead, through very sophisticated research that uses network modeling, that looks at geographic factors, that looks at structural factors, as well as individual behaviors, in our cohort study of 1,200 young gay and bisexual men in Chicago, we were really able to show that it's driven by differences in network structure, differences in the rates of HIV within different neighborhoods, the risk of exposure to HIV, given those network characteristics, and has little to do with any individual's behavior, sort of an emergent property of the network. So I think that's just an example of the sort of sophisticated work that we're doing to understand the intersections of race and sexual orientation disparities. I'd also just say that we're doing a lot to lead when it comes to LGBT youth. We've really been a pioneer in the study of young people. Many of the first studies of LGBTQ teens, the first large-scale studies, have been led out of ISGEM, and we're really excited to see how other universities are now stepping up to participate in those kinds of research as well. But we've conducted studies now with sexual and gender minority teens as young as 13 years old. We know that young people are coming out at younger and younger ages, and it's really important for us to understand their experiences and how to meet their needs. And are beginning to look at things like, how do we work with schools to roll out something like sex education that works for LGBTQ teens. So we're really excited to be on the cutting edge of some of that work as well.
Thank you. I also want to highlight two areas of strength that we have here. Bisexual health is one. Our faculty, Brian Feinstein and Christina Dyer, are experts on bisexual health. And one thing that a lot of people don't know about this is that within the LGBTQ population, especially among young people, bisexual is the most common identity, the most common sexual orientation. And so considering that fact that this is the most prevalent population within sexual and gender minorities, the fact that it's been studied very little is astonishing, and we want to remedy that. And also this population experiences significant health disparities, even compared to their gay and lesbian counterparts. And another topic that we study and research extensively is relationships. Michael Newcomb on our faculty leads those studies, and we joke in the Institute that what comes after gay marriage is staying married or staying in a relationship. And so Dr. Newcomb studies healthy relationships and how to improve communication around the partnership among same-sex couples. And he also studies at the other end of the spectrum of healthy relationships. He studies violence within intimate partnerships in women, specifically lesbian, bisexual, and also in transgender men. And this research is very important because we know that being in a relationship, in a healthy relationship, buffers the effects of oppression and discrimination and marginalization, but clearly that's not the case if it's there is violence in that relationship. We also have some areas of growth that we always look for support in growing in these areas that are really, really important. And for the sake of time, I won't go right now into each of them, but maybe in the Q&A, if people are interested, we can talk more about that. Especially cancer is a very important topic that Brian mentioned earlier. One thing we would be remiss if we didn't discuss is our contribution to COVID-19 research. Of course, we're a health institute. We would not shy away from the wealth of research that is happening. And I'd like Brian to briefly tell us about his involvement in this research.
Yeah, thanks, Francesca. When the global COVID pandemic began, we had to quickly mobilize to make sure all of our staff were able to safely work from home. And as soon as we were sure that we had safe working arrangements for people, we really mobilized our staff who have exceptional skills when it comes to things like recruitment and engagement with minority populations, media buying, advertising, recruitment and retention, communicating with participants, health information, and began partnering with other investigators around Northwestern. A couple of things that we've already launched is, you may have seen in the news, the importance of COVID antibody testing. There are still fundamental questions about the, for individuals who've been infected with the virus, what proportion of them develop antibodies, how long do those antibodies last, how protective are those antibodies against future infection. These are still fundamental questions that we need to begin to answer as quickly as possible. And we partnered with investigators in the Center for Genetic Medicine, in the Department of Anthropology, to develop an at-home COVID antibody test that's really performing exceptionally well. It is a test where somebody pricks their finger, puts a droplet of blood on a card, sends it back to our lab where we do an ELISA, and that allows us to quantify the amount of IgG antibodies. And we're now drawing from our experience with health disparity research, we're rolling that out throughout particular neighborhoods in Chicago to understand the dramatic race and place-based disparities in COVID that we're experiencing within Chicago, as well as in many other communities throughout the country. We've also launched data collection and already have papers under review looking at the impact of COVID on sexual and gender minority youth, looking at sexual and gender minority adults as well, understanding the extent to which they've been able to engage in social distancing, how many people in their network have experienced infection, how it's affecting their mental health, how they're coping. So many questions that we are making sure that the needs of sexual and gender minority people are being represented. And we're also doing broader initiatives that are hopefully going to lead to answering some of these fundamental questions in terms of how to respond to COVID.
Thank you. And now I'd like to discuss the other areas of our mission, training. We are proud of our postdoctoral training program. We have fellows come in residence at the Institute for 1 or 2 years. And I'm happy to report that our fellows go on to receive prestigious faculty positions, either at Northwestern or at other institutions. And these are both research track and tenure track positions. So we're really excited to be able to give people the training that they need to go on to become successful SGM researchers. And one thing that I think might be slightly unique about our institute is that even our staff, our research staff and admin staff, these are people that come to us for a passion of the work that we do and our mission. And oftentimes when they leave our institute after 2 or 3 years of working for us, they are going on to medical school or graduate school, pursuing careers as future researchers and also health providers. And I have this slide here that I'd like Brian to tell us, you know, why it's important to foster the career of SGM people in the field.
Yeah, just briefly, I'll say, you know, when I started out as my career focusing on sexual and gender minority health, it was a very small group of people that had that interest, that had the experience working with our community, providing healthcare, conducting research. And I'll say it's gotten a little bit bigger, but not significantly so in the last nearly 20 years. And, you know, that's not surprising when we look at some of the data. We know that lesbian, gay, bisexual youth are more likely to be bullied in schools. You can see the data in terms of how many of them report that. This is on the left, data from representative samples of high school students showing that LGBT youth are disproportionately likely to experience bullying and victimization in school. We know that they're less likely to get parental support when they go to college, and financing college and getting through the college experience can be a challenge. There have been some surveys of LGBT academics working in STEM disciplines. We know that in this one particular study of LGBT scientists, overall 43% out to less than half of their coworkers. So very few people feeling comfortable being out in STEM disciplines. And I think that's also reflected in very recent data collected by the NIH, looking at their intramural workforce, people who work at the NIH, that sexual and gender minority people were the group most likely to experience harassment in the workplace amongst all of the groups that they looked at. And so, you know, this really creates challenges, and we're trying to now move to do more and more to continue to advance the development of SGM scientists to really create the next generation of scholars who can do this work, who can help answer these questions. And we'll be sharing some more with you about that.
Thank you. We also have a mission to educate the public and disseminate our research. We are happy to announce that this coming November 15th, marks our 5th anniversary. We are 4.5 years old right now. We feel we have accomplished a lot, but we know that that's a very young institute, so there's a lot of potential for growth with your support and the support of Northwestern. And we have launched a Leaders in LGBT Health lecture series in addition to our regular lecture series. And these are folks that will present on the past 25 years of research, people who started doing this research in SGM health when it was still a controversial topic. And we want to know, what brought them to the field. And we want to hear from their wisdom. Of course, these lectures will be online because of COVID, and we hope that you will sign up for our listserv and you will join us for those presentations as well. I mentioned that we have a regular series. We also have an annual symposium and an annual keynote lecture. And we have 2 examples here of recent presentations. On the right is our faculty member, Michelle Burkett, presenting about how big data and network science is biased against minorities. And we also had a guest lecturer on the left, and you can see the slide says, race is not a risk factor, racism is. LGBTQ identity is not a risk factor, homophobia and transphobia is. And that is really a message that we want you to walk away with from this presentation. We're also very proud that every 2 years we bring an LGBTQ Health National Conference. It has grown to over 370 attendees. Next year is in Chicago. Fingers crossed that it will be in person by that time. And for this conference, we partner with our community partner in Chicago, the Seton Halsted, and also with Emory University. And so every 2 years, the conference alternates between a Chicago location and an Atlanta location. So if you don't catch it next year in Chicago, we'll see you in 3 years in Atlanta. And if you sign up, again, you can find out more about this conference. I mentioned that we have been really successful in obtaining external funding from the federal government. In fact, 95% of our expenses are supported by federal grants that pays for our research. And we're also supported strongly by the provost at Northwestern, the dean of the Feinberg School of Medicine, and the Office of Research. You can see, though, that while a 95% federal funding means that our research is excellent and it attracts external funding, it also puts us in a precarious position, because that means that we, if the federal landscape were to change for LGBTQ health research funding, then we would be affected. And so we ask for your involvement and your support. If you want to get involved with us, you can talk about our work and share our website with people that you know, your friends and family, people who can use the information that we create and disseminate. Sign up for a listserv. There is a link on the last slide. If you want to support our work and the junior scholars that I mentioned earlier. And I also know that among the audience today in this webinar, we have some donors who have supported in the past. So I really want to extend a really big thank you, because everything that you've heard in this presentation is also supported by our current donors. And I'm going to leave the slide up as we do Q&A, so that you can write down some of this information. If you don't have a pen and paper available, we will also be sending out a PDF of this presentation, so you will have a chance to get this information via email after the event. But here is how to contact us, how to sign up for our listserv, where to go to make a gift to our institute. And if you're interested in a legacy or a state gift, here's also Larry's contact at Northwestern. And I think now that I mentioned Larry, I'm going to turn it over to him for our moderating our Q&A.
Thank you, Brian and Francesca. What a great job in showcasing the Institute and all the great work that's being done right here at Northwestern and down at the Feinberg School of Medicine. I have to say, we're also getting a lot of terrific questions, so I'm not going to take any more time. I'm going to jump right into the Q&A. And along the Northwestern line here, maybe Brian and Francesca, as a proud Northwestern alumnus, I'm excited to see Northwestern and Feinberg taking a leadership position with this research. What inspired each of you to pursue these careers, and what advice would you give to others who want to pursue a similar career path?
Yeah, thanks for that question. You know, when, as I mentioned earlier, when I was starting out my career and having my interest in LGBTQ health, there were very few folks, there were very few academics, there were very few professors who had that as the focus of their work. And in fact, one of my mentors explicitly discouraged me from going into this work because his concern was there wasn't really any career to be had, and it would be a really difficult road. And I think, you know, for me, when I was in graduate school, I was studying young people. I was working as a child and adolescent health psychologist. This was my training. We were really seeing this growing rate of HIV in young gay and bisexual men. And, you know, it was really alarming. And I opted to go to a national conference focused on the HIV epidemic, and was fortunate to give a talk about some of the work that we were doing on young gay and bisexual men. And I found that I was really one of the only people talking about that issue, that many people were focused on other populations that had a much lower risk. And there was kind of an assumption that it was impossible to study young gay and bisexual men. They were too hard to recruit. There were too many challenges with IRBs and regulations. And so almost no one was doing it. And I felt this sort of moral need that, you know, I'm a member of the community. I've had the privilege to be able to go to graduate school, to get this education, to have these skills, to understand adolescent health. And I just felt this sort of moral calling to make that the focus of my career. You know, I've really been driven by that passion ever since. You know, I think it's a challenge to get into this field because there are very few senior researchers who have a lot of experience that run large labs to create opportunities for graduate students. I know at the Institute, you know, we have many more fellows who are interested in training with us than we have capacity to even take on as much as we would want to. And, you know, I think for many folks, that means getting graduate training in a related area and learning the most you can, the strongest methods in your discipline, whether it be medicine or epidemiology or public health or psychology or in any of the many disciplines that work on LGBT health. And then, you know, finding opportunities during your postdoc or your fellowship to get additional training in SGM health research. I think that's the route most people go. You know, we've been working hard to grow the opportunities that we have for fellows at the Institute. The number of fellows we have ranges somewhere between 5 and 10 each year, depending on what funding we have from grants. You know, recently we had a donor who supported a fellowship line for us to support a fellow in an area that was really underdeveloped in SGM health research. So we are happy to have a new fellow joining us in August who's focused on the health of rural SGM people. That's an area where there's been almost no research. You know, really almost everything we know about sexual and gender minority people is sexual and gender minority people living in urban settings. And so we're really happy to have this opportunity to support the career development of a postdoctoral fellow who's going to be focused on older adults. But, you know, I think my advice is get the best training you can, find those opportunities to connect with people who are doing this work. I think it's a very welcoming community. I think there are tremendous opportunities to have impact because it is such an emerging field still. So you could join our work, you could join this field and really make an important fundamental contribution in many areas of health where, you know, as of yet, there's been very little SGM health research.
Yeah, that's a great question. And I'm going to stop sharing so I can see all of you. That's a great question. Thank you for the opportunity to reflect on this. I worked at the University of Illinois, Chicago for 18 years when Brian came to recruit me there so that we could build this institute together. And I have been doing LGBTQ activism on campus there, but this job was really an opportunity to bring that passion together with employment and pursue the mission of this institute that I so much believe in. And so my advice is that even though you might be in a job where you don't think your passion for activism or for justice is relevant, if you continue to pursue your passions, there's a possibility that somebody will notice and that your next employment opportunity will bring those things together.
Thank you both. I'm going to build on that question a little bit here. It's a similar question, Brian. You talked a little bit about you'd like to hire or you'd like to recruit more doctoral fellows. Are you making an emphasis on diversity and people of color, kind of recruiting from both prestigious and maybe not known as prestigious institutes?
Yeah, so very important question. You know, I think that it's something that we've been focused on for a long time. And, you know, there's a couple opportunities I'll mention. So one of the things that, you know, to give a shout out to Francesca, she's really been phenomenal since the beginning when we launched our conference to create opportunities for scholarships for scholars of color, scholars from underrepresented groups to be able to attend the conference. In 1 year, we were able to fundraise $20,000 in scholarships for early career sexual gender minority health researchers from underrepresented groups to attend the conference. You know, that really creates this opportunity for them to learn from the other scholars, meet some of the senior people in the field, to have those networking opportunities that are so important. And, you know, we stay in touch with them. We have a special reception for the scholars at the conference. That's a pool that which we can recruit from when we have fellowships that are available or job opportunities that we'll go back to as well. So, you know, that's definitely, speaking of one of the great things that Francesca launched that, you know, I think is really a great idea. And, you know, we continue to look for opportunities to be in solidarity with initiatives to diversify the academic and healthcare workforce.
Terrific. We'll keep moving along here. We've got several to go. How are you working, how is the Institute working to educate family medicine, internal medicine doctors, or even doctors in specialties on the unique medical issues of LGBTQ people?
Brian, is it okay if I answer that one? Okay. Yeah, thank you. Great question. So we are part of Northwestern University and the Feinberg School of Medicine, and our Chicago campus has a partnership with Northwestern Medicine, the hospital downtown. And so we've been partnering to support each other in the work that we do. And we are partnering with them to sponsor trainings for their healthcare workers. For example, we have had lecture attended by over 300 people, including hospital administrators, medical providers, nurses, front desk staff, receptionists, etc., to provide all of these people working in the medical field with trainings around LGBTQ 101. We did a trans health 101. We did a session on how to use correct gender pronouns. And I must really tell you that Northwestern Memorial Hospital is so hungry for this information. And we've been connecting them to speakers who can provide expertise. If we have expertise in-house, we have those lecturers go and present. If we don't have the expertise in-house, we'll connect them to experts in the community. And you know, usually our lecture series draws 80 to 100 people, but their lectures draw 300 plus. And so it's been a pleasure working with them to provide that very needed competence that they know they have a need for, and we're happy to partner with them.
Terrific, thank you. Can you talk a little bit about what the Institute is doing in terms of the psychological and physical health needs of aging and older LGBTQ people?
Yeah, that's a really important question, and I think we moved quickly through the slide about areas that we hope to grow, and I would definitely put that into the category. As a child and adolescent health psychologist myself, much of the work that the Institute started with was focused on young people. And I think that also reflects broadly what's going on in the nation in terms of research. So, as I mentioned, I serve on an advisory group to NIH focused on SGM health research. And when you look at the funding that they provide, only a little over 1% of the grants that are focused on SGM health come from the National Institutes of Aging. So there's, less than, and I think that probably reflects the reality, probably less than 1% of SGM health research has focused on older adults. Such an important thing. We know that the HIV epidemic had devastating effects on an entire generation of gay and bisexual men. We know that family rejection, breaking of family ties leaves people vulnerable as they age. And we hear stories of seniors going into retirement homes and needing to go back into the closet because it's not a safe environment for them to be themselves as they reach that milestone of their life. And those are really alarming. And I think that that's an area that I just think is absolutely critical that we invest in, that we grow, that we connect with scholars that are working in geriatrics, that are working in the health of older adults, and really find ways to connect with them and support their opportunities to do this work, because it's nationally, it's very rare, and we know that there are really important issues. There are a few emerging pockets of research suggesting some alarming patterns in terms of the development of dementias and how some of the experiences of isolation, chronic stress may predispose people to some adverse effects related to dementias. And I think that's just beginning to scratch the surface of what's being studied. Before I mentioned the alarming pattern of inflammation in young people, if you have high levels of inflammation in adolescence and young adulthood, and that carries on throughout your life, it really sets you up for risk for a variety of chronic diseases into adulthood. So I think that's just absolutely essential, and an area that I hope, in the coming years, if we do this update again, I hope to be able to talk about some growth that we've seen in that area.
That's terrific. Thank you, Brian. We've had several questions somewhat similar here about, in light of the recent protests on inequality and disparities, and even in the era of COVID here, how can that positively impact and potentially improve the quality of the LGBTQ community?
Well, I'll say that I think any movement towards attention to equality and justice is a movement that creates opportunities for solidarity and opportunities to advance the well-being of a variety of communities that experience injustice, that don't experience equal opportunity to achieve their optimal health. And I think it's been long in coming, this attention, and it's very welcomed by us. And I think it does create opportunities for us to communicate the work that we've been doing on racial disparities and how they overlay with sexual minority health and sexual minority health disparities. It really calls us to redouble our efforts to advance the careers of minority scholars and attend to the ways in which we might be complicit in creating challenges for minority scholars. So I think this is a welcome call, and really unfortunate ways in which we're called to attention, but nevertheless, I think one that's welcome and that is beyond needed.
Terrific. I appreciate this question coming from the group. How can philanthropy specifically help ISGM? What could a gift specifically support? And I know you talked a little bit about that, Francesca, but maybe you can expound a little more.
Yeah, Larry, I feel you might be the right person to answer that question. There is nothing in everything that we said that we do that doesn't need support. And, you know, our three-part mission of research, training, and dissemination, any of those areas can really benefit from, you know, small donations, small recurring monthly donation to a large gift. As Brian mentioned earlier, we received a large gift to support a postdoctoral fellowship, and that person is doing research that is really understudied for rural LGBTQ people. We could not have afforded that without a donation. And you know, there are opportunities to support our dissemination, our lecture series, our symposia, and directly to support pilot training for our research. For example, a few years ago, we had a donation that supported pilot training for a faculty member who was actually not related to our institute, but a faculty member studying HPV and cancer. And we partnered with her, Mary Gerand, to study HPV vaccination in young men who have sex with men. And that resulted in a publication first from the pilot study, and that resulted in a grant proposal that was ultimately really highly scored and funded. And that shows you, Larry, how a small investment on the part of a donor was really able to generate you know, millions of dollars in funding from the federal government. And so we like to say that there is no, you know, no donation that is too small. We have some, you know, monthly donations in the $25 range, and they all go to support the work that we do.
Thank you, Francesca. I know we're getting near the end of our time here, so I've just got two more questions. Does ISGM provide resources on research regarding LGBTQ youth to the Chicago public schools, or, you know, schools nationally at that level? And I'm sure the parents who are on this call as well would be interested in this information.
Yeah, I'll try to quickly hit off a couple of points. So yes, absolutely. You know, as I said, young people are a particular strength of the Institute. Several years ago, we issued a report called, there was a Healthy People, a Healthy Chicago report that had been put out by the Chicago Department of Public Health. And we produced a companion report on the health of LGBTQ youth with a particular focus on the health of the LGBTQ youth in schools in Chicago. And so we've been, you know, drawing from the data, the evidence that we have that characterizes the health and health inequities of young people in Chicago to really help inform initiatives. I frequently work with the Chicago Department of Public Health. I'm on a number of task forces related to LGBTQ people. And we have other faculty who work closely with Getting to Zero, Ending the Epidemic Initiative in the state, who work with Chicago Public Schools. So really important partners. We have also done some exploratory work with schools in various states with some support from a parent of a Northwestern student. We began discussions with different schools about the services that they provide to LGBTQ youth, and that's been something that's continued, and we're now doing interviews with schools around the country to understand how we can help them with the evidence-based programs that we have to advance the health of LGBTQ youth. So particular area that we're have been doing a lot, and I really think we'll be doing more in the future.
Thank you, Brian. And then lastly, we have a question. Oh, Francesca, I'm sorry.
Yeah, I wanted to add something to what Brian said. You know, 4 years ago, when the current president was elected, the Centers for Disease Control had planned to hold a summit on the health of LGBTQ youth, and they decided to cancel that because they didn't think the administration might be supportive of that topic. And we stepped into that void and told them that we would organize it. And we had a really productive two-day national symposium on the health of LGBTQ youth. And I'm happy to report that, you know, in classic timely fashion in academia, the articles from that symposium were published last year, and they are available on our website. And they show, we focused on schools and families as both sites of support for LGBTQ youth, but also struggle. And I really encourage people to go to our website and look for those articles. They're really important about the development of youth in these two settings.
Yeah, and we were happy to see in the end, the authors included, you know, our faculty as well as representatives from the CDC were able to serve as co-authors on those papers, as well as authors from community youth serving organizations and academics around the country. So it really, you know, is a really nice set of articles addressing those issues.
Yeah, and also these representatives from the CDC, they are the folks that set this funding agenda for the next 5 years of funding cycle. And so partnering with them means that we can have a voice, hopefully, in guiding, you know, guiding them towards the issues that we feel need to be studied. And those are the areas that we discussed earlier that are both our areas of strength and areas that we want to grow into.
Well, thank you both so much. Brian, one last quick question and then a couple closing comments. What is on your reading list now, Brian?
Wow, that was a surprise question. You know, I mean, I think, gosh.
We may have to send that out post.
Yeah, I have to check my, listening to a lot of audiobooks right now, actually, trying to find some time to get outside and take walks and listen to audiobooks, but I'm happy to share it when I have a chance to pull it up.
Very good. Well, listen, thank you, everyone. Thanks to Brian and Francesca and Babette and all the people who helped to put on this event. We did get another question that just came up about volunteer opportunities. I would encourage you to submit that to the listserv or via the email that we will send out after this event. Do get involved, and what we can ask of all of you, please spread the word. This is happening at Northwestern. We can be very proud of this institute and the work that they're doing. Please let others know who might want to learn about this and have them get involved. Thank you all very much, and happy Pride Month.